Testing. All right, guys. So again, my voice is still not back to where it needs to be. So if you can't hear me from where you are, I invite you to move up as you need. So the key thing before I get going, our little first 5 minutes, the joints and the joint motions that we're going to start to develop have similar communicational concepts as the ones we just had. Obviously, there's going to be different planes and there's going to be some different challenges for illusions, but they all follow the same rules. Where are you at? The joint position is relative to anatomical. And then where are you going will be referenced to other factors besides going in and out of fetal. Because obviously going in and out of fetal is a very sagittal plane concept. You're not going to get into a ball side to side, and you're not going to get into a ball transversely. But there's going to be other references that we could use to practically communicate instead of angle changes, which could be this one or that one. And as you shorten one, you increase another. There's just a lot of confusions when we just talk about angles. So we're trying to keep it practical. We're trying to keep it functional to help us see these. The next thing I want to emphasize in the first 5 is, although we won't use global landmarks, we will use local landmarks. Cole brought up a couple weeks ago about the chin to chest as a reference for cervical flexion. So we're going to use local marks. We just don't want to use the eyes relative to the room, but we can use chin to chest. If these things get closer together, you're more in the fetal. If they get further away, they get out of them. So we'll use local landmarks for us to use as references, whether we have significant changes. Okay. So today, we're going to get into the ankle and subtalar joint. The ankle and subtalar joint. So what I'm going to do is I'm going to remind you of what we're talking about, and then I'm going to do what I do, and that's give you a lot of analogies into what I'm trying to teach you, okay? So the ankle and subtalar joints are 2 separate articulations. If you were going to highlight, star something of importance, meaning a lot of students miss this concept, it's that the ankle joint is an entirely separate articulation than the subtalar and transverse dorsal joints. Okay. Practically, what I'm trying to say is that when you move your foot side to side, that's a different articulation than when you move your foot up and down. Okay. The ankle joint is a uniaxial hinge. So I think on Moodle, I reminded you, I took out one of the slides from Unit 1, and the uniaxial is like structural and the other one's functional. Sometimes my dyslexia confuse it. But a uniaxial, one axis, one plane of motion, about one fixed point. So how many motions will we have to account for? 2. Good. The ankle has 2 different forms of flexion. You can get into a ball, you can get into fetal 2 different ways. You can get into a ball when your feet are on the ground. We call that dorsal flexion. And you can get into a ball with your feet off of the ground. We call that plantar flexion. So there's no extension with the ankle because there's 2 different ways you can get into fetal. So it still follows the same rules as these other joints that get us into and out of fetal. Okay. The ankle joint is formed by the distal fibula, the distal tibia, and this talus, this dorsal bone called the talus. Okay, and so the talus kind of it's like they call it a mortise, but it's basically sits in there and rotates in its sagittal plane. If you think about it, we definitely don't want that talus bone. We don't want it to do this type of movement. That just looks like it would hurt, right? That's a bad day. We also don't want this talus to move transversely. Like if the talus rotated transversely, it would literally, you could see how look at the fibula and the tibia getting like pulled apart right there. So we don't want it to do like this, or the distal long bones would pop out, right? okay? So it only allows for normal sagittal plane motion. Underneath the talus, subtalar, so like underwater, submarine, under the water. Underneath the talus lies the calcaneus, the navicular, the cuneiforms, the cuboids. And these are rocky tarsal bones that shift and glide and have slight movement, okay? These are great for a couple of reasons. One is they help dissipate force. A practical way of thinking about it is if you were going to jump off of a building, you'd rather land in sand than on concrete because the sand can shift and groove and there's space in between all those little granules of sand. So it's very similar. All the force that we're putting on our feet, it helps to dissipate that force if we have little granules of sand that kind of shift and dissipate. If your foot was one rigid bone, you would have a lot of stress fractures and breaks if this was just one rigid unit. So one way I kind of think about it is that those tarsal bones are the stress fractures. Like they are where the stresses kind of dissipate in the space. Okay. Let's go to this. So in a skateboard, for this analogy, you have two main types of function. You have the wheels, obviously, and the wheels are important for you to go forward and back. But also you have the balance, you have the wobble. So I call the wheel and the wobble. The wobble is going to help keep your center of mass over your base of support so that you don't fall off, right? Okay. The wheel, in this example, is underneath the wobble. Make sense? Okay. Our ankle joint is our wheel. But unlike a skateboard that can just spin in the same direction forever, our wheel only has a certain amount of range of motion before you run out of room. So you got to take it off of the ground, reposition it so that you can continue that wheel action. In addition, when you're riding on a skateboard or roller skates, the surface of the ground has to be smooth. You can't go roller skating on rocky terrain or in the woods. So for us, our wheel and wobble is inverted, meaning this is our foot that can reposition itself and shape shift over rough surfaces or imperfect surfaces. And our wheel, now obviously we don't have four wheels, but our wheel on top, that's our ankle joint that allows us to plantar and dorsiflex. Does that make sense? Okay. So for us, wheel is going to be very simple. It's going to be this motion that's going to help propel us forward. We just can't continue to spin, so we got to rotate, lift up, reposition, lift up, reposition. But it's the wobble that I want to emphasize today. Like if you were going to be doing a stork stand and you were going to be balancing on one foot, your wobble isn't on top of the wheel, it's underneath the wheel. So when you're balancing and your skateboard is trying to balance to keep your center of mass over your base of support, that's happening underneath your wheel. Does that make sense? So here's your wheel, the true ankle joint, the talocrural joint. There's your wheel, and underneath the wheel, all of these right there, there's your wobble. And we call that the subtalar and transverse tarsal joints. It's a separate articulation. Now, what type of joint is that? That is what we call a gliding joint. It's a non-axial, it's still an arthrodial joint. But the way I like to try to think of it is, has anybody ever played with dominoes when you were kids to knock them over? Okay. So you have dominoes. So you have dominoes, and you're lining them up, okay, and you're going to knock them over. Now this is a front view. So in other words, they're looking over the top, and you push this one down, and they knock over in a straight line, right? After a while, that gets boring, and you want to start changing directions. You want to start moving to the right, to the left. But what you find out right away is you can't line up the dominoes and then the fifth one do a 90-degree turn. Does that make sense? You have to gradually turn it. You have to do, a little bit here, then a little bit here, then a little bit there, then a little bit here, and then next thing you know, after a while, then you're off to the races, right? Does that make sense? So one change wasn't necessarily a lot, but the sum total of all the little changes is significant. It's like collecting pocket change. You know, one day's worth of pocket change may not buy you a latte, but maybe the sum total of a month might be able to get you dinner. Okay? So you think about this slinky rotating 180 degrees, but all of that motion didn't happen on one fixed point. It was the sum total of a bunch of little bits. Does that make sense? It's kind of what we're talking about here. So when you take your foot and you roll it in and out, let's see, I'm trying to not stop the video, but I'm also trying to get a view of, one day I'm not gonna get up and then tell my family I love them. So, I don't even know if this is gonna work. So when you do this is important to know that that's happening underneath your ankle joint. That is not your talus doing this inside the mortise made up of your distal fibula and tibia. It's underneath, and it's the sum total of all those little dominoes summating their motion. So when people sprain their ankle, most of the time, it's not your ankle. We just say ankle because most people wouldn't understand what a subtalar transverse dorsal joint is. How many of you have ever heard of a high ankle sprain? That's an ankle sprain. There's nothing high about it. That's literally spraining the uniaxial hinge that's your talus in the socket formed by the mortise. And that makes sense because damage to your wheel is going to affect a lot more than the damage to your wobble. Because with your wobble, if anybody's ever had a low ankle sprain, a lot of times it's possible to still go straight. It's when you kind of go side to side. In other words, there's no damage to the wheel. There's damage to the wobble. When you have a high ankle sprain, a true ankle sprain, there's damage to the wheel. And so that's why it hurts a heck of a lot more, and it's a lot harder to heal because every time you put weight there, you're bowing that tibia and the fibula. Because that talus rotated too much, usually it's transverse, and so it literally bows them out. So the key thing here is that when we're talking about ankle, we're specifically talking about the uniaxial wheel component. And when we're talking about what I'm going to teach you is inversion and eversion, that's a separate articulation underneath the ankle joint. Another analogy I like to use is the ankle and subtalar joint live in the same apartment complex, meaning you have what we call a joint capsule. And in that joint capsule, it's just basically a water balloon. It's your ligamentous stuff, and there's a water balloon in there. That's what your synovial fluid, and it's basically your joints engine oil to try to lubricate and have as little friction and wear and tear as possible. Okay, so it's your body's joint lubrication system. The ankle and subtalar joint live in the same apartment complex, but they don't live on the same floor, if that makes sense. The ankle is going to be on the second floor and the subtalar is going to be on the bottom. Does that make sense? Another analogy, if that analogy didn't work for you, is that if you look at roads, some roads, intersections, like a four-way stop, the intersection is literally in the same place. So like my wrist, the intersection of the bilateral and the AP is in the same place. But other roads might look like they meet, but it's an illusion. There's an overpass and an underpass. So that's similar. The ankle joint would be like an overpass, and the subtalar would be underneath it. So from the top, it might look like they're intersecting in the same place, but they're not. Okay. All right. So let's get to motions. Ankle joint. Well, first of all, any questions, clarification. The key thing here is that they are two separate articulations. Okay, it's not happening in the same place.
They're separate, but are they connected? Like the bones themselves, they're connected, right?
Well, all of your bones, unless I'm not understanding your question, but like that's like the hand bones connected to the right. So all of our bones are connected, but the articulations of those bones are not happening in the same place. So let me try to reword it and guide me to your question. So the ankle is specifically the talus connecting to the distal fibula and tibia. The subtalar is the calcaneus to the talus. So underneath, so this articulation. Then the cuboid to the talus. Then the cuboid here. Then the cuneiforms here. So it's everything that's not here. So in other words, none of these subtalar bones connect to the fibula or the tibia. So yes, the ankle joint is made up of one tarsal bone, but only one, and only on the top. The subtalar joint are all the other tarsal bones as they connect to the talus on the bottom. If that makes sense. All right. So again, think of it as the wheel and the wobble. Okay, the wheel and the wobble. From the wheel's perspective, our ankle, I mentioned we have two different forms of flexion. I'm going to give you the practical examples, and I'll try to give you a lot of other examples. Let's see if I brought this up without messing up the angle, because I'm going to have to be able to get. There's nothing but great props here, Coleman. What's that? Oh, it can? Let's see. That's better. Awesome. Me and laptops this semester have a very bad relationship. Okay. So, I'm going to give you practically speaking, and then we'll get into some functionally speaking. So, anatomical position, right? If you were going to get into fetal with your feet on the ground or weight bearing, right, or closed chain, however you want to call it, you would have the type of flexion that gets you into this specific type of fetal called dorsal or dorsiflexion. Okay. Some people remember it in terms of like a dorsal fin, on the top of a dolphin. You can use local references, meaning when the dorsum of the foot gets closer to the anterior part of the lower leg, I have no problem with that. Okay? Or, so in other words, this would be just as much dorsal as this. Gets to the same place. From here to there is the same as from there to there. Okay? The other type of flexion we have at the ankle is plantar. Plantar flexion. So plantar from anatomical will look like this or this. Or if you go up on your toes, it might look like this. Okay. So if you want to keep it consistent, you could say the posterior gets closer to the posterior, but if you keep it consistent, like we do with the chin and the chest. So in other words, if I say chin gets closer to chest or chest gets closer to chin and my cervical is going to have flexion, then the opposite is also true. If these two things get further away, I have to have extension. So you don't have to say if these two things get closer, it's flexion. And if these two things get closer, it's extension. So in other words, you could just pick two landmarks and then make it relative to those two landmarks. Okay? So when the top part gets closer to the front, dorsi, whether that's foot move about shin or shin move to foot, gets to the same place. Okay? Now, anatomical position. What's my position of my ankle? Dorsi flexed, because it's relative to anatomical. Does that make sense? Just like flexed, extended. So same concepts. So I go from anatomical to a dorsiflexed position. I have to have dorsiflexion to get there. I go from a dorsiflexed position to anatomical. I had to have plantar flexion to get there. I go from anatomical to a plantar flexed position. I had to have plantar flexion to get there. I go from being plantar flexed to being anatomical. I had to have dorsiflexion to get there. Dorsiflexion from, plantar flexion to, plantar flexion from, dorsiflexion to, dorsiflexion from. It's the same concept. That make sense? Sometimes it might look confusing because we might do dorsiflexion from, plantar flexion to, and then we go up on our toes. But all that is plantar flexion from. Dorsiflexion to, dorsiflexion from, plantar flexion to. Make sense? So if you were going to step on the accelerator, you'd probably plantar flex, take your foot off, dorsiflex. So two different forms of flexion. Guys, I'm telling you, I'm going to ask on the test about ankle extension. And it's going to be tempting. But I'm trying to teach you why we don't have extension. Because we have two different ways to go into flexion. Because unlike our wrists that are straight, our foot is at a right angle. It's functional reasons to be that way. So no ankle extension. Okay? All right. Any questions before I get into the wobble? All right. So this is going to be our first dive into non-sagittal movements. Okay. Now, the wobble, unlike the ankle I love because you have your medial malleolus, malleolus, lateral malleolus, malleolus. But basically, you have the inside and the outside. It's a bilateral axis. If I've ever seen very obvious bilateral axis. And remember, the inside of your ankle is still the inside of your ankle, even if it's at the top. This is still the medial part of my ankle. So the bilateral moves with my ankle no matter what. Okay. The glide of the tarsal bones, there's not one specific axis. Like, there's a little one here and a little one there and a little one here. It's a bunch of little arrows. Okay. So what we can say is mostly frontal plane. Mostly. Okay. Mostly. And your tarsal bones are under no obligation. Let me see how I can set this analogy up. Has anybody ever seen the movie Finding Nemo? Okay. Do you remember at the end when all the fish are trying to escape the net and they all go on the same page to swim down and swim up and swim down? Okay. So our tarsal bones can move similarly, meaning all of the tarsal bones can choose to bend and slightly move in the same overall direction, but they don't have to, which is great when you're trying to balance, when you're walking in the park and there's roots and there's uneven surfaces. You kind of want the tarsals to be able to kind of cancel out and shift and do their own thing. But sometimes you need all the fish to swim the same direction. Okay? So for us in grad school, when you guys go to grad school, you are going to learn specific movements within the tarsal bones, like pronation and supination, or rear version and anteversion, specific things that can happen within the tarsal bones that cancel out and do some cool stuff. For our class, we're going to just look at how all the fish could swim together. How can all of the fish contribute to the sum total of all my dominoes curving one way, or how all my fish can contribute to all my dominoes going the other? Does that make sense? Okay. So when my tarsal bones shift and summate all of their motion in one direction, specifically when the medial part of my foot gets closer to the medial part of my shin, we call that inversion. Make sense? And when the medial part of my foot gets further away from the medial part of my shin, we call that eversion. One way to look at it too, I would use like a door analogy. So in other words, when I'm inverted, it's like the doors are closed and I'm keeping everything in. And when I efflux, I open the doors and everything comes out. Okay. Now, here is your first introduction to something I call the mirror effect. Okay? If I were, let's see. I have to use our imaginations here, guys, but I think this is going to work. So, if this was a mirror, okay, and I did right shoulder flexion, the mirror is going to mimic what my left shoulder motion would look like. Meaning, I know in the mirror it's my right arm, but because it's a mirror, it looks like my left. Does that make sense? So when I do this, my mirror does the same thing. Sagittal. Arm goes up, the mirror goes up. However, if I went across, unless the mirror is possessed, the mirror's arm isn't going to do this. If I go out, the mirror is going to do this. Does that make sense? I'm going somewhere with this. Does it make sense? That the mirror effect is going to be a mirror of what I do, even though it's doing the same thing. So that's how we have to look at some of these non-sagittal motions. The mirror effect is going to help us to see that these motions that might look different are the same. Because if this was a mirror and I made my medial part of my foot go away from the medial part of my shin, the mirror would do the exact same thing. So in other words, this is not the same motions, even though it might look like it, like, windshield wipers. This is the same motions. This is the same motions. This is the same. This is the same. Because of this mirror effect. Make sense? Okay? All right. So, right subtalar. The long word is subtalar and transverse tarsal joints. But it's like having someone's name be Christopher and we're just going to call him Chris. So we'll just say the subtalar joint for short. Right subtalar joint inversion. Now I am inverted. Right subtalar joint eversion. Eversion from, inversion to, inversion from, eversion to, eversion from, inversion to, inversion from, eversion to. Left, inversion from, eversion to, eversion from, inversion to. Left subtalar joint eversion, right subtalar joint inversion. Right subtalar joint eversion, left subtalar joint inversion. Those are, it looks like it's moving, and it is. Okay. Here's the key. Remember, this is in a different place than this. It's important for us to know. Our mamas and our papas, our uncles, the people we work with, who cares? It's all ankle. But we need to know that the wheel is not taking place in the same place that we have wobble. Okay? That makes sense? Now, let's get into some illusions. Let's get into some illusions. The purpose of that wobble, not only for balance, but it's also to try to keep your surface area, your whole foot, interlocked with the ground for friction reasons. So if I were to, let's say I was stretching, and I'm trying to keep the flat part of my foot connected to the flat part of the ground, if I didn't have this wobble, this would happen. See how useful that is? Help keeping our foot interconnected with the ground by using our wobble, by using our subtalar. So if I go from here and I do this, I need you to see that, hey, the inside of my foot got closer to the inside of my shin. In other words, this is the same as that. You see it? Or this is the same as this. Right subtalar joint inversion from, eversion to, eversion from. Probably not a lot of people do this kind of stuff. So in other words, your body, you're going to have the roads on these range of motions that you need for practical and functional movement. So the fact that we have more inversion makes sense because we do a lot more of this kind of shift than we do this kind of shift. Makes sense? Inversion. Same thing. So I think that example is, it looks like it's not moving, but it is. Because if all you've ever been taught is that inversion and eversion is moving of a foot, I can still have the same motion, but my foot doesn't have to move. Does that make sense? It would be no different than saying ankle motion is when your foot moves. Well, I can move my ankle and not move my foot if the socket goes about all. Right? It's the same thing, just underneath. Okay. All right, here's some common questions. And Cole, think about some. I'm going to toss it over to you if there's any insight on you. Common questions I'm going to ask on the test. How many motions does the ankle joint do? That's just straight up me seeing if you know that the ankle joint is the wheel, and the wheel only has plantar and dorsi. Literally telling you I'm going to ask that the inversion and eversion is in a different apartment than the plantar and the dorsi, even though they live in the same complex. All right, Cole, you have some insight, what worked for you or what
Yeah, the hardest part for me was like the squatting and seeing how fast the dorsey flexion, because it's like we keep dorsey flexion, I always think what comes up, but it doesn't have to be.
Gotcha. So if we're practicing, to Cole's point, anatomical, this would be bilateral ankle joint dorsiflexion from, bilateral ankle joint plantar flexion to, and then if I continue, I could go up on my toes and I can have plantar flexion from. Dorsiflexion to, dorsiflexion from, plantar flexion to, plantar flexion from. That makes sense? So in other words, a full range of motion of plantar flexion could look like this, or it could look like this. The same changes.
So if we were to do like a calf stretch, it'd be really fun.
Yeah. Yeah. So if we were to do, and guys, I'm sorry, even though I don't hold a chart, I don't make you buy a book or something. I guess once we got into the lower extremity, I should have made you guys have to buy sunglasses because, I'm pretty pasty. Skin cancer runs in my family, but I also thought it was important to just see the medial and lateral. So if I was here, yeah, that would be dorsiflexed. My position relative to anatomical. And if you're going to do like a toe drag, you'd be plantar flexed. But even though they're new words, the rules follow the same. Your position is relative to anatomical. And your motion is based off of change in position. That's all it is. So without even showing you, if I say you start in anatomical and you end plantar flexed, you know you had to have plantar flexion to get there. It's like saying you started in Lafayette, you ended in Roe Bridge, you had to travel east to get there. If you start dorsiflexed and you end plantar flexed, you had to have plantar flexion to get there. Make sense? Yes, ma'am.
Can you do like the A version, E version one more time whenever you were moving your foot off the ground?
Yeah. So when my foot was off the ground or on the ground?
I get it when it's on the ground, like off.
Okay. So this is the one you're having trouble with?
Mm-hmm.
Okay. So the way I would look at it is, are my tarsal bones gliding, like the domino analogy, where they're bringing the medial part of my foot? Sometimes I might use big toe or little toe as a reference, just as a reference. Meaning the big toe is like the team captain of team medial side, and the little toe is the captain of team lateral side. And so if my big toe gets closer to the inside of my shin, I'm going to have the motion we call inversion. Because all of those little dorsal bones contributed. And if my big toe gets further away, or you could say if my pinky toe gets closer to lateral, it's whatever works for you.
What's a little on your leg when it cross your back?
Oh, so when my foot was on the ground.
Oh,
Okay, that's all right. Okay, so let's see. Remember, did I forget Ken Bell? Sorry, buddy, he loves coming to class. Do you remember? I know you remember. We said, this doesn't look, sorry guys, I'm getting old. This doesn't look like hip motion, but it is. You remember that one? Very similar. This may not look like subtalar joint motion, but it is. It's similar concept because I can say, where did I start? Anatomical. And where did I finish? I'm inverted. Because if I was still in anatomical, I'd be here. Does that make sense? And the only way to go from anatomical to being inverted is to have inversion. And this is the part I think that's important. You know, sometimes I get criticized. I don't mind criticism. I'm going to do things the way I think it should be done based off of experiences that I've had with 20 years of student. One of the reasons I don't use a textbook is because the textbook's only going to show you this. They're not going to have all these different examples that look different. You know, so great, you have this textbook that shows you how to use a hammer, but what if you need something other than a hammer? You're kind of in trouble. So, you know, it's common for certain books to say flexion. That's awesome. But there's so many more illusions that can happen that aren't, it looks like it's moving. And it is. Okay. All right, so review. Ankle joint, uniaxial hinge, two different forms of flexion, plantar, dorsi. If you were waking up from sleep, you probably wouldn't wake up dorsiflexed. You'd probably wake up plantar flexed. Yeah. When you're sleeping, you're not weight bearing, your feet off the ground. But if you're standing and you went into a ball, you would dorsiflex. You wouldn't do this. Think about it. Danger, right? You're trying to get into a ball, you know. Hey, heads up! Ah! You probably wouldn't do like you probably wouldn't Michael Jackson it, right? You probably like heads up! Ah! Right? You wouldn't want to do plantar. You want to do dorsi. So it's two different forms of the same sagittal concept that we had other places. Getting in the fetal, getting out of fetal is just the ankle. There's two different ways you could do it if you're weight bearing. Okay. The subtalar joint is not the ankle joint. So when you're doing ankle exercises in the water, the ankle is going to be responsible for this part, and the wobble, the subtalar, is going to be responsible for this part. So when you're doing these, you know, you're doing your alphabet, you know, all that motion isn't happening in one place, but that's okay. It's like, how many of you are familiar with what an Etch-a-Sketch is? You ever played with the Etch-a-Sketch? So the Etch-a-Sketch has one magnet, but there's two different knobs. One knob goes up and down. The other knob goes left to right. And when you move them both, you can do like circular paths. Does that make sense? When you're moving them both, as you go up, you go to the right, and you can make circles. So you can do these circular patterns, but you don't have a circular knob. You have two separate knobs that you're moving to make these smooth movements. Does that make sense? Any questions? All right, this is what I like to do. Cole, we'll go float around. We'll have a few minutes of lab work. I would love for y'all to do some open chain practice. All that means is it looks like it's moving in these. Do the ones that are obvious. Then stand up and do some of the illusions so that we can try to feel, oh, I see, when I do this, instead of the top coming up to the front, my just front went down to the top. So let's move and do a few of these, and then we'll call it okay? Guys, I will give y'all some advice. We're about to get into a lot of joint motion. Some of them are going to be easier than others. It's important to stay up with the information as best as you can. If you wait